Wagner has embraced many challenging roles, most of them uncharted. She has been a social activist on both sides of the Canada-US border, a fly-in doctor to the far north, a long-standing women's health researcher, and a pioneering physician for women with HIV/AIDS. Born in rural Wisconsin, she first became a human rights advocate when her family moved to rural Alabama in 1967. As a student in Ohio during the height of the anti-war movement, her passion for social justice was further galvanized. This brought her to Ontario's Grindstone Island, where she ran peace and social justice programs before returning to medical studies. Freshly graduated, she chose Indigenous communities in the far north as her first place of practice. When a colleague in Toronto contracted HIV, Cheryl again relocated and discovered a tremendous need for doctors who would take on the challenges of a new disease, AIDS. That meant when women began to become infected, she was there for them, one of just 2 female GPs treating this population. Cheryl was able to identify a man who was deliberately infecting women with HIV and pushed for legal action. Cheryl continues to care for many patients who are marginalized by stigma and circumstance. Her practice extends out of the office and into the community, where she makes house calls for people who might otherwise fall through the cracks. Cheryl cares for her patients, mindful of where they live, how they survive, and what they hope for, what matters to them. But this humble humanitarian also has her mind fixed on changing the system, to make life better, not just for one patient, but for entire populations.